So I think we'll get started. So welcome. I'm Marie Harvey. I'm the Associate Dean for Research in the College of Public Health and Human Sciences. And I'm pleased that you are joining the seminar today. And I'm also pleased to introduce Rick Setterston, who is the Barbara Knudsen Endowed Chair and Professor in Human Development and Family Sciences here in the college, and has recently been named the 2021 University Distinguished Professor. So congrats, Rick. So he has joined us today and will provide an introduction for today's speaker. He'll moderate the session and he'll provide more instructions about the format. So pay attention, he'll tell you how to ask your questions. So let's get started, and please join me in welcoming Dr. Rick Setterston. Take it away, Rick.
All right. Thanks, Marie. Hello, welcome everyone to this Friday research seminar of the College of Public Health and Human Sciences at Oregon State University. We're so glad that you're here with us today. As Marie said, I'm Rick Setterston, and I have the privilege of leading our college's School of Social and Behavioral Health Sciences and of moderating this session here today. You'll notice that we've muted all your microphones. To ask a question, please use the Q&A feature in Zoom, and you'll see it in the bottom right-hand corner. Please feel free to send questions to me at any point during Dr. Webster's presentation. I'll keep track of them, and then I'll moderate a discussion for the last 15 to 20 minutes of the session. We're delighted to have Dr. Daniel Webster here with us today. Dr. Webster is professor at the Johns Hopkins Bloomberg School of Public Health, where he's also the director of their Center for Gun Policy and Research, co-director of their Center for the Prevention of Youth Violence, and he's also leading a collaborative between Hopkins and the city of Baltimore to reduce violence in the city. As we all know, gun violence is a pressing and complicated societal and public health issue, and it's one that has really profound effects on families and communities. I know we are all eager to hear from Dr. Webster, whose presentation today is titled Public Health Solutions to Preventing Gun Violence, Opportunities and Challenges in 2021 and Beyond. Please join me in extending our warmest welcome to Dr. Webster. And Jacob, if you could turn things over to him.
Thanks very much. It's great to be here. I am going to go ahead and share my slides. Bear with me just for one moment. Okay, just. So I've been working in public health on the issue of gun violence for about 30 years, and a lot of ground to cover. I'm not going to take you through everything that I've done, but I want to highlight today both some successes, but also some real challenges that we face that I feel like are really huge challenges that we have not fully embraced just how deep those challenges are and what we need to do to have a profound impact on this problem. I want to start just with a little bit of context of how unusual gun violence, the levels of gun violence is in the United States. Our homicide rates, when you compare the United States to other high-income Western democracies, are about 8 times as high. And if you look at the firearm-related homicides, that differential is in the magnitude of about 25 times as high as the average high-income Western democracy. There's enormous racial disparities in the United States for lethal violence. If you just look at homicide rates, over 10,000 people were killed in 2019. It's the leading cause of death for Black males ages 15 to 34, the second leading cause of death for younger children, and the second most important cause for the Black-white disparity in life expectancy among males. I want to give you just a little bit of historical context. Now, this is for younger people, for principally for teens and their trends. Um, the overall population rates are somewhat similar, not quite as dramatic, but I mostly want to just focus on how rapidly homicide rates with guns increase for young people in the United States beginning in the late 1980s. That's when I got into this. Actually is what motivated me, how many young people were dying from gunfire in our cities in particular. But also note how rapidly that slope goes down in the 1990s. Quite remarkable. Um, and now there is a noteworthy and concerning increase over the past roughly 8 years that we need to be mindful of. There's a wonderful book written by a sociologist, Patrick Sharkey, called Uneasy Peace, that tries to explain this dramatic decline in the 1990s in murder rates broadly in the United States. To summarize, the takeaways from that is that a lot of that decline was achieved through rather brute force with very heavy handed and perhaps overuse of police and prisons to get there. And what his book uh, uh, presents basically is alternatives to try to reach peace with less reliance on police and prisons. Of course, many of us were thinking through these very issues over this past summer in particular, when there were widespread calls and protest against police violence, and really calls for alternative ways to make communities safe. I was part of a group convened by the John Jay College of Criminal Justice, an advisory group on preventing and reducing community violence. We produced a report this past November, Reducing Violence Without Police, a review of research evidence. It was a great group of scholars. I was very proud to be part of that. I just want to summarize a few points from that, and then I'm going to dig in a little bit more about some of my own research. So the key evidence-based recommendations from this group, and I'll underscore, the title might be a little bit misleading. It's not as though these activities occurred in the absence of police, but basically these are strategies or policies that don't rely upon police to reduce violence, and in some cases lethal violence. So the evidence fell into these following categories. One is improving the physical environment. Um, Lethal violence and gun violence in particular is very concentrated, and physical blight in particular is very closely connected to it. Strengthening anti-violence social norms and peer relationships. There's a broad area of research. I'm going to touch a little bit on that in my following remarks. Encourage and support for youth. Substance abuse is really critical. So in public health, of course, that is one of our tools to reduce violence, is through effective means for reducing substance abuse, including effective treatment and prevention. Mitigating financial stress. That, of course, is very critical right now with so many people in deep, living on the edge, literally, in these pandemic times. Reducing harmful effects of criminal justice, and then confronting the gun problem. That, of course, is a lot to unravel, but I will dig into that with some degree of detail. Now, what I'm going to focus on just in my remarks here is going to zero in on the gun part of violence. Many of these other recommendations, the evidence, weren't necessarily specific to guns. But one thing that more and more cities are now investing in is this idea of cleaning and greening lots in urban areas with a lot of trash and blight. And you can see in these pictures how these areas were in people's neighborhoods can be very, very different. And this is one such study from Philadelphia, shows an 8% drop in shootings connected to this activity. This is a randomized trial, by the way. Since this study came out, there have been several others that have replicated with remarkable consistency and sometimes even larger effects. Incredible return on investment with this approach. A slightly more costly, but still actually more effective way to address blight was to better secure vacant homes, vacant properties, and really make them look like they're occupied. Now, the picture of what you're looking at now looks like a totally new house. It's not actually, but it can be done in a cost-effective way. This was also tested in a randomized trial and found to reduce shootings by 39%. It's worth noting that there are many other social and health benefits connected to these kinds of interventions that make our neighborhoods nicer places to live. There's also strong evidence showing that in areas with a lot of vacant homes, simply demolishing those, when there are blocks of many vacant homes, is associated with lower rates of violence. Street lighting, improving street lighting, good evidence that that reduces violent crime, including gun violence. Deconcentrating poverty. This is sort of the crux of structural racism that is literally baked into our cities, and very explicit public policies that try to deconcentrate that poverty have shown to reduce violence, including gun violence. And even how we draw our school districts so that they allow more low-income individuals not to be segregated in their own schools, but into other schools as well. Now I want to focus on health workers in particular. And when I say health workers, that includes community health workers as well, and whether they can reduce outbreaks of gun violence and how dependent they might be on others in order to be successful. So one type of intervention that is quite popular now, growing quite substantially, are hospital-based violence intervention programs. In these cases, typically if someone comes in with a gunshot wound or stab wound, they, once they're of course stabilized, there is outreach to that individual to get them a variety of kinds of social supports and help to reduce their risk for repeat violence. Now, even though these programs have been around for a very long time, there are very few randomized trials. Only two that look at principally adult populations, one of which was in Baltimore where I work. And that program in particular is one that gets held up as the evidence that have been used to advance this policy. And you can see how stunningly different the violent injury rates are for treatment and controls in this trial. What I want to underscore this replication of this program model is based upon a study with a very small sample size, roughly 100 people divided between treatment and controls. But the particular thing I want to highlight here is that all of the subjects involved in this study were on parole or probation at the time of the study. And it also represents a very select group. Many chose not to participate. So one of the things I think we have to grapple with is how dependent are we on criminal justice as being, in essence, a backstop for the public health types of interventions. So I don't want to necessarily spend a lot of time, but I just want to underscore that there are studies out there, but generally there are very few randomized trials with a lot of methodological issues that make it difficult to know truly their impact on a broader population and the capacity at which those programs can reduce population effects. Now, a very another popular public health approach now goes by sort of a brand name, cure violence, is one that I've studied in Baltimore for over a decade. Basically, the components of this program are center around outreach workers who are considered to be credible messengers. They're typically someone who is from the neighborhoods and they're working, but also have had some history of involvement with crime and criminal justice system. Their charge is to engage with these highest risk individuals in their neighborhoods and really promote nonviolent responses to conflicts or provocations, help in some cases mediate those disputes themselves, and generally mobilize the community around different norms for addressing violence. I'm first going to just summarize some studies outside of Baltimore and then go into detail in my own. There are a couple of studies published from Chicago where cure violence what originated, at least this version. The first trial showed beneficial effects in 4 out of 7 sites. A subsequent study found in both sites consistent reductions in gun violence. 15% reduction in shootings, non-fatal shootings, 38% reduction in homicides. In Philadelphia, in 4 neighborhoods, overall average of 30% reduction in shootings. Now, in New York City, they've also had some success, some early trials around 20% reductions in gun violence. In more recent years, they've recognized, and this is something I think is really quite important, is that this sort of the basic cure violence model probably needs to be updated and enhanced with more support. So in New York, they created something called the crisis management system to get more intensive supports, social supports, and assistance for the individuals at highest risk and to get that to them quickly, which is really critical. And in those cases, we've seen some, in East New York in particular, a pretty robust effect of 45% reduction in gun violence. Now, in our studies in Baltimore, I'm not going to show the earliest study that actually showed a little more beneficial impacts of the first 4 sites. But we recently published a couple of studies looking at 7 sites over a span of some of these for a decade or more. And sadly, we had somewhat disappointing findings. Our first study, we used basic regression models to control for risk within those neighborhoods and baseline rates. And we generally did not see any kind of consistent pattern in homicides and non-fatal shootings changing in response. In one neighborhood, there was a significant increase in homicides, whereas another in Cherry Hill, a 39% reduction. Now, Elwood Park, in this case, was a very short intervention period, and it could, with a rare outcome, could be due to chance. Now, we just published some, Shawnee Buggs was the lead author, a former doctoral student of mine. We just published something in injury prevention a couple of weeks ago using a little different analytic tool. It's called synthetic control models. If anybody's interested in it, we can talk about that in the Q&A. But there our findings were no better, in some ways actually worse. The only significant findings we found were in the direction of actually more violence. It's important to underscore some of the context for some of this study period. In the spring of 2015, there was an in-custody death of a young man named Freddie Gray in West Baltimore. And the city erupted in very substantial riots in response to that. This, of course, was a buildup of a lot of frustrations with police department in communities most impacted by guns and drugs. When we looked at the impact of that, we call it an uprising, a social uprising, greater than a 50% increase in homicides and shootings connected that. But we wanted to see for the sites that had that where the program was adopted in a period where you could actually measure whether there was differential change before versus after the uprising. We saw in 2 out of the 3 neighborhoods basically it being harder to reduce violence once those set of riots occurred. Now, we have been trying to learn from this process, and particularly for the frontline workers, what are referred to violence interrupters. And one of the things here are some of the key things that we learned, and this study was led by another former doctoral student of mine, Jennifer Whitehill. We found that the hardest conflicts to mediate was a retaliation for a previous homicide. So the so-called code of the street that you needed to retaliate was very hard to push against. When they were trying to mediate those kinds of things, what the violence interrupters said is that they were really trying to stress that you can go to jail if you retaliate. And so part of what I've come to believe is that there is a codependence between this frontline public health intervention and how well the police can actually hold people accountable for shooting people. So that's so I think sometimes we think about these as public health responses as alternatives to police, but in many ways it could be best to think of them as complements to police. So the things that we're grappling with now in Baltimore as we think about how to improve and revitalize what that program looks like, we call it Safe Streets. The things that are under consideration: what's the right kind of mix of workers? Does everyone have to be credible in the sense that they have a criminal history in order to work? I sort of feel like there needs to be some mix, in essence, of that workforce. I think we need to know more about what is driving the violence so that the response of the work is more on point. I've learned an incredible amount from violence interrupters about what actually, what are the set of sequence of things that lead to violence. Another important thing I think for us to consider is all of these programs have been operated in very strict boundaries, neighborhood boundaries in which the workers work. And it's sort of based on an assumption that all the violence that occurs there is sort of internal. So the people living there, if you can just work with them. But we actually found in Baltimore that's often not the case at all. There's a lot of movement across neighborhood lines of perpetration of violence. So I think rethinking that. Better relationship with law enforcement, I think, is another thing that we're going to be grappling with. And then application of things that we know that really are helpful in behavioral modification using cognitive behavioral theory, for example. Now, another public health model that's newer, that's getting some favorable outcomes, I think takes a very different approach than the cure violence model. It's much more investment in the individual. It now goes by the name of Advanced Peace, and they give what they call peace fellowships to those individuals who are the highest risk, who might be driving the violence in a particular area. It's a big and long-term investment in these individuals to try to steer them in positive ways with mentoring, but even stipends and travel and other kinds to really broaden their horizon. In Richmond, where the program initiated, there was a 55% reduction in gun violence, and there's some promising data coming from Sacramento as well. Now I'm going to take you back to the Baltimore data again. The study that we were trying to look at the effects of Safe Streets, public health intervention. We're also looking at law enforcement. And I just want to highlight a few things that we learned from that. The specialized units that were focused on illegal gun possession were indeed associated with reductions in both homicides and non-fatal shootings, 12 and 19% respectively. The drug law enforcement was quite interesting. So we saw that simply arresting a lot of people for illegal drug possession actually increased shootings over a 12-month period, whereas um, crackdowns that were very specifically designed with a much smaller group involved, those who were driving the violence, were actually associated with significant reductions in gun violence. Now, I highlighted that these specialized gun units, there were two different kinds in Baltimore. One was called the Violent Crime Impact Section. They were working in what we call hotspots, the parts of the city with the highest rates of violence. There was another unit called the Gun Trace Task Force that also was doing somewhat similar work. It's sort of a long history about them. But the main takeaway that I want you to understand is that this group really went rogue, committed a lot of crimes, and really a lot of harm and distrust from that. Many of these guys are in federal prison now. That prompted my team and my center to begin working with police and prosecutors to really look at what they were doing so that they had a more accountable process for enforcing gun laws. Our belief was that you should not simply stop enforcing gun laws, because we know from not only from our studies but others that they actually do reduce violence, but you have to have accountability processes in place. I'm not going to be able to go into all the details of this, but I'll just summarize by saying that we used a variety of kind of evidence, including surveys of the most impacted communities, as well as data from Baltimore to really highlight what needed to be done to have more transparency and have police supervisors really identify problem actors, so that you don't end up with another gun trace task force debacle. That sort of takes me to this issue of police violence, and I'm going to try to draw some connections here. So this is something we appropriately are focusing on now. There's roughly about 1,200 of these deaths per year, and there's clear disparities with Black rates being about 2.5 times higher than whites. If you look at this at a state level and this difference between Blacks and whites and a rate at which they are killed in police shootings, they're very directly, that ratio is connected to measures of structural racism across states. So basically, more structural racism, the greater disparity that you see in this indicator. I want to underscore that roughly 17% of Blacks are killed by police. Blacks are unarmed when they are killed by police. And that's a lot of the instances we're focusing on those, because they're the most or the least justified kind of acts of police violence. This slide just sort of gives you a flavor for over 2013 to 2019, between 50% and 57% of people who are killed by police have guns when they are shot. And that's what I want to focus on for a moment here. And again, this sort of intersection between racial bias and presence of guns. One study found that as the percentage of a neighborhood that the more the residents are Black, the more times police are using their guns, not always to shoot, but to point or threaten. And importantly, there was that effect was much greater for white officers than for Black officers. Many of you probably remember the tragic incident of Fernando Castillo when he was shot in Minnesota by a police officer. He was a legal gun owner, concealed carry owner, who did everything right, and yet the presence of the gun prompted the officer to begin shooting and killed Mr. Castillo. So much of our attention has been focused on race, but again, I think it's the intersection of race and firearms that are particularly important. In a study published in 2018, David Hemingway and colleagues did a study to look at differences across states and the rate at which people were killed by police shootings. And what they found is enormous disparities or differences between what they refer to as high gun states or low gun states based upon the prevalence of household gun ownership. And you can see the slide, roughly fourfold difference overall. And if you looked at the differential of citizens who were killed when the citizens had a firearm, it's a fivefold difference. Again, so guns are playing an important role in this public health problem. So what policies can reduce firearm access in risky situations? Because it's really those things that are creating these tragedies. And our comprehensive background checks the answer. Do you need something more robust? Oops, I'm not sure what happened here. Okay. So just to summarize, we've been studying this with colleagues at University of California, Davis, published a variety of studies. We're not seeing any longitudinal change in response to changes in laws that simply extend background check requirements to private sales. There's a number of reasons why this might be. Part of it has to do with how broad the prohibitions are. It's actually a surprisingly number of people with violent records who still can legally possess firearms in many states. And actually, in some states, the majority of people who are committing violent crime with guns are not prohibited. They are legal gun owners. Some of this may have to do with the problems with records in the system. And I personally think a lot of it has to do with poor law enforcement that therefore leads to poor compliance. What we found is something that has been working is a licensing process in addition to a background check requirement. So these comprehensive background checks require the background check when you go into for sale. Usually, like if it's a private seller, you would go to a licensed gun shop in order to, and that gun shop owner would actually facilitate the beginning of a background check. You would not have any direct involvement or connection to law enforcement through that process. In licensing, you typically do engage with law enforcement. Typically, they do fingerprinting, and sometimes they require some type of safety training as well as a background check, of course. Maryland changed from a comprehensive background check system to a licensing system in 2013. They also adopted some other things that tightened their gun laws, or mandatory reporting of theft or loss of gun in particular, and they gave state police a little more authority to crack down on gun shops who weren't complying with gun laws. What we found looking at crime gun trace data and an indicator of what we call diversions of guns for criminal use, it means the gun goes from a retail sale to a criminal suspect, almost always who is not the purchaser of record. We found a 76% reduction in this indicator in response to this new law. We also surveyed men on parole or probation in Baltimore City about their own experiences in the underground gun market in Baltimore. 40% told us that the passage of this law made it more difficult to get a gun. It affected the cost and the willingness of others to purchase a gun on their behalf. Now, we've studied, actually, it's remarkable that sometimes the best way to study the impact of a law is when it goes away. So, Missouri had a licensing requirement for handgun purchasers dating back to the 1920s, and they repealed that law in 2007. So, you no longer had to go to the local sheriff to get your permit before you got a gun. Looking again at this same indicator from crime gun traces, where guns moved quickly from retail sale to crime involvement, we found a twofold increase coincident with the change or repeal of this law. We also saw from these same crime gun trace data that the Missouri was accounting for more and more of the guns used in crime compared to guns coming in from other states. Most importantly, we saw a clear departure in trends for gun-related mortality in Missouri compared to the rest of the country and regional comparisons. Here we're looking at firearm homicide rates that you see a sharp increase in 2008 immediately after the law goes into effect. In this gap between its regional or national other states continues all the way into 2017. Now, they actually weakened even more gun laws in 2018, and this rate of increase is going up even more. This is the suicide trends. Again, we see that this upward trajectory coincident with the change in this law, the upward trajectory going much sharper in Missouri than in comparisons. Now, we did extensive statistical analysis, in this case using synthetic control. This study was led by another former student of mine and now faculty member, Alex McCourt. We contrasted what happened in after states adopted comprehensive background check requirements for handguns in the states of Pennsylvania and Maryland, and with changes in purchaser licensing laws in Connecticut that adopted this type of law in 1995, and Missouri's repeal that I just explained to you using synthetic controls. Basically, what synthetic control does, it allows you to very closely fit the right combination of states that are most similar to the state that's changing the law so that you get a better fit of your model and a more valid estimate of program effects. The first, so the solid line here is Missouri's firearm homicide rates, and you can see the vertical dotted line where the law changes and how it departs from its synthetic control forecast based upon our statistical model. You see something similar with respect to firearm suicide rates. This again is Missouri. And if you look at Connecticut, which adopted the law after after the 3 years of the law being in place, you begin to see separation with much lower rates for Connecticut compared to the synthetic control. You see, and then you see a more immediate effect and differential when you look at firearm suicide rates in Connecticut versus its synthetic control. This table just summarizes some of these synthetic control estimates compared to placebo test states that did not change their laws, and we tested whether their rate of change was different from that in the states adopting these laws. The only significant changes that we saw for homicide were for Connecticut and Missouri, 28% reduction in Connecticut and a 47% increase in Missouri. Now, it is worth noting that there was also an 18% increase in homicides committed without guns. So some of this is probably other social conditions going on, but the differential effect is quite substantially more for gun-specific lethal events. If you look at suicides, again, the only significant finding you see, except for non-gun suicide rates in Maryland, which of course shouldn't be affected by the law, but principally it's focused on these licensing law effects. In Connecticut, it was a little bit more complicated because they adopted sort of a precursor of what we now call red flag laws that allow law enforcement to remove firearms from people who are threatening violence against others or themselves. And it turns out for these laws, far more commonly, these are response to threats of suicide. And so we did see protective effects for both kinds of laws. And again, in Missouri, there a significant increase in firearm suicides. Now, we also find other evidence that purchaser licensing in Connecticut in particular was associated with an 80% reduction in law enforcement officers fatally shot with handguns in a line of duty, and the opposite kind of effect in Missouri, where officers were getting shot more after the repeal. We also independently, on a separate study, see that these laws are also associated with fewer mass shootings, fatal mass shootings. So this takes us back to the, might these laws also be relevant to if they're bringing or allowing fewer guns into these high-risk contexts, might they also be helping lower rates of at which civilians are killed by police? And here, just a simple bar chart with the blue bar showing the purchaser licensing states. You see substantially lower rates at which they are being killed in such encounters compared to states with weaker laws. This differential is even more pronounced when you subset the civilians who are killed by police when armed, when the person killed was armed with a gun. So just some final thoughts. It's clear that structural racism leads to the kind of policing models that lead to more profiling, more stops, arrests, and officers' use of guns that elevate risks for Blacks being killed by police. But high prevalence of firearms also contributes a very important amount to this problem that lead to both more civilians and police being killed. By more police engagement in the context of structural racism and implicit bias, and while wide firearm prevalence, you're going to have more people shot by police. What we've seen in Baltimore, but now in many cities during 2020, is these police violent acts lead to communities withdrawing from police and substituting their own justice, so-called street justice, which means more community violence. Bottom line is we have to address the structural conditions that create both guns being too easy to get for high-risk people and for police to respond in biased ways. And I think licensing gun purchasers will be one such solution that will help address this problem. I am going to stop sharing my slides and open up to whatever questions folks have.
So Rick, you're muted.
All right, I see that. Thank you so much, Daniel. I really appreciate your thoughtful presentation. At this time, I'd like to encourage anyone listening to go ahead and submit questions in the Q&A featured in the lower bottom right-hand corner. I've got a few questions here already, so let me just jump in. One actually concerns a tension between sort of, laws which happen at state levels. Mm-hmm. As you were just describing a minute ago, Daniel, that in turn affects prevalence in terms of issues around CBC or around licensing, And yet so much of the important activity is also sort of local. It relates to local police approaches. It relates to the people in those more local environments and the lives they live and experience. So I don't know if you could say something about that tension
Yes,
between the policy levers being state-based, but the action often being more local. And then a second part of that has to do with many of the studies that you opened with, especially where there are interventions, targeted interventions, are of course in large rural environments, and um, and then the focus often on the state level leads you to maybe homogenize the view in a way that would also leave us to wonder whether the issues going on in more rural environments would have different causes and different consequences.
sure.
So
Yeah.
I'm sorry, that's a little bit of a big question, but there are those two parts.
Okay. All right. Well, that's great. It's a big and important set of questions there. So, you know, I've been working in Baltimore now for roughly 30 years, and but this is a case in any city that has high rates of gun violence. We tend to focus on this is a local problem. When legislators try to address this at a state level in Annapolis, um, other jurisdictions that don't have the same problems as Baltimore sort of say, "What's wrong with you, Baltimore? Just get your act together and deal with your own problems." But the truth of the matter is that many of our problems, guns just being one, but an important one, they really set the stage. And guns are a complex issue, and it sort of gets to, I think, the last part of the other question. Um, from an epidemiologic standpoint, there is what we would refer to as effect modification. What that means basically is um, the presence of guns means something very different in uh, the level of risk of the context. So in Baltimore, let's just think about Baltimore, city of redlining that dates back many, many, many decades, um, and principally African American communities that have been cut off from opportunities for generations. And in that context of great social and economic stress and strife, more guns can really add to a lot more death. In other communities in our same city um, that are more wealthy and white, they are not experiencing that because it's the confluence of the presence of guns in the riskiest context, social context, and that's both with respect to neighborhood and with respect to individuals. So, um, I mean, ideally, we would have better federal laws. So, as Maryland has tightened its gun laws, now the majority of our guns are coming from other states. That doesn't mean that that's all for naught, our state laws. But generally speaking, the localities that are struggling with, systemic racism and issues that plague those cities, they're harmed by the lack of strong gun laws. Now, um, there are things obviously localities can do and should do, and that's what we're trying to do in Baltimore and many other cities as well, recognizing that there's sort of two parts to this. One, as I spoke to, was enforcing the laws on the book, and how you do that matters a great deal, and that's sort of where I think the emphasis needs to be right now. In some communities, it's a broad stop and frisk, very racially biased, and just erodes trust between police community. You can do this in a very different way, and I've seen it done, and that's sort of the survey data that we got back from the affected communities. They said, ironically, uh, there's broad policing except for the most violent people. So they really want more focused approach on the law enforcement, and then more help and resources for the people at high risk. So it's a complicated thing, a set of equations. Some you can affect this with local initiatives, but to to achieve big sustainable population impacts, I think you have to have strong state and federal laws.
Thanks. So building on that last, some of the last part of your statement there, somebody does ask, would you care to comment on the defunding the police movement, or
Sure.
less radically, just shifting police fundings like the militarization of law enforcement to other social services? And there is a kind of movement, of course, around the country, but here in our own state, some efforts in that direction. So I
Right.
don't know whether you would care to comment on that.
Yes, I feel like I should. It's something I think about all the time. Um, so I think we are having a healthy conversation to really think about how do we want to create public safety. Um, we need the police in a country with a Second Amendment and as many guns as people, roughly. Um, we're going to rely upon some people who enforce the laws of the land who are armed. That is just, I don't think we're going to get around that. I think that we can use our resources far better, though. Um, we over police for minor crimes that are just uh, oppressive and burden people and do little to keep us safer, while at the same time, we don't invest in addressing the most serious forms of violence. Typically, cities and neighborhoods in particular with the highest rates of violence have very low rates of murders being solved. And there's a reason for that. It's remarkably under resourced. You would just be shocked to know how little homicide detectives have to work with, what their caseloads are. At the same time, we're running cops out to do a bunch of things that really end up just being harassment. So, yes, I think we're wasting some money on some of our policing, but we also need some reallocation. So, I focus a little bit less on the defund part and more on the reimagine part of we really, I think, in order to achieve the best and fairest way to achieve public safety is deep, deep reforms in law enforcement simultaneously with these investment in communities. And that's what I think is sort of the, I'm a public health person and I'm a public health policy person. And so um, I, I, I just firmly believe that in public health, our eyes need to be on the public policies that are creating structural inequalities, including issues and reforms needed in a justice system and in guns.
Excellent, thank you. So in turn, someone says it's refreshing, it's a politically charged topic and it's refreshing to see the data presented in an unbiased manner. And that
Appreciate
makes
that.
me, so that's a simple thank you, but it makes me wonder, in conducting this research on this topic over 30 years, I guess I'd love to hear you say a little something about maybe some of the struggles or challenges you've had to confront
Sure.
as a researcher, kind of working in neighborhoods and with the people and in them, and working with police and in working with legislators. Maybe say something about yeah, just what that research experience is like and how you walk that line between in being a strong researcher um, on a politically charged topic.
Thank you. That's a great question. Um, well, I won't lie, it's stressful. But I tell you, I have met so many incredible people who, many of whom are survivors or people who have lost loved ones, and the sacrifices that they are making in order to make it so that no other, fewer people suffer this problem. Um, and I sort of go into public health recognizing, and in this topic in particular, that anything that's important, there are political aspects of it. I mean, we're seeing that with COVID. We're seeing it with so many aspects of what affects public health. So it just sort of comes with the territory. I am the son of a former politician, and so maybe I just roll with that. Um, but I actually, it's one of the things that drew me to public health, a sort of recognition that rather than think about all of our problems as individual problems, like what's wrong with this person? Why did they end up in this place and get shot or shoot somebody? Thinking about this in a very different way and say, what is wrong with a country that has such a high rate of gun violence, that is so uh, disparate in its impacts? And it's a different way to think about it. And I recognize when you do think about things in that way, you're going to bump into people who are getting uncomfortable about that. And you know, I have to rely upon my science, and actually reporting on background checks actually is a great example. Many people, said, "Oh, he's biased. He's bought off by Michael Bloomberg or whatever." Then I start publishing all these studies that show that the background checks laws that are being saying, "Oh, this is what's going to save us." I'm saying, you know what? The empirical evidence doesn't back that up. You actually have to do more than just background checks. So um, I feel that the science is a bit of my protective shield, if you will.
Well, thank you so much for that response. I think it's the sort of response that will inspire all of us to think about why we do the work we do and the challenges that we face as we do it, and in trying to take the results of our work outward to the communities and people who can use it. So thank you for that message to close on. It seems to me to be a perfect message to close on. And I would just like, on behalf of all of us, to say thank you to Dr. Webster for this most engaging presentation, and we're grateful for your time and your presence here today.
It's good to be with you.